I'm Dr. Jojo of Vancouver. This movie shows you how to cure tennis elbow, and this is part of my article that is the complete menu for you to cure tennis elbow. The muscle that need rehabilitative exercise are the elbow extensor. That's number 1, 2, 3 muscle in the picture. And then to do the best treatment for a rehabilitative exercise for these 3 muscles, it's best to start with the elbow flex as in number 1 in the picture, and then the wrist dorsiflex as in number 2 in the picture, and the hands squeezed together so that the 3 muscles are tightly contracted. You start from that point, then you extend the elbow, and then palmar flex the wrist from the full contraction of the muscle extensor to the full stretch of these injured muscles. They are given the best exercise and the best stimulation to regrow new myofibril tissues. Studies have found that during eccentric exercise, that means the workload of the muscle is being done while the muscle is in the lengthening phase, myofibrils are more liable to break down. The breakdown will provide growth stimulation for new myofibril tissues to replace those broken one and injured one. Please read the liability disclaimer. In the following short clip, I show you how the muscle extensor will go from the totally contracted state to the totally stretched state. The wrist should palmar flex at the totally stretched stage. Palmar flexion is bending the wrist forward. The normal hand grips the bar as if you're holding a bicycle bar, and the hand of the injured arm should hold it with all the 5 fingers forward, including the thumb. They should be all in front of the bar to give the most stretch to the injured extensor muscle of the elbow. Tying a glove on the handle will be safer to prevent a slippage forward of the injured arm. At full elbow extension, the wrist of the injured arm should palmar flex to bend forward to further stretch the injured muscle. This push-up rehab exercise can be done without any glove too. But each session, you should not overexert the injured muscle. 2 push-ups is enough to have an effect, and a maximum of 5 for most people. Some cases of tennis elbow keep recurring is because some of the tennis elbow have bony alignment. You look at the pictures, the radial head, which is A in the picture, insert into C, which is the annular ring of the ulnar bone. There are 3 bones in the elbow. The upper one is the humerus, and then there are 2 bones on the lower half, the forehand. 1 bone on the thumb side is called the radius, and then the bone on the baby finger side is called the ulna. When the radial head A is slightly off the annular ring, there's some form of misalignment, and because of this, keep on rubbing on the joint surfaces and give rise to inflammation, and this is why it keep on recurring. There are 2 ways to correct the elbow alignment of the radial head. One way is to use a high velocity, low amplitude kind of chiropractic adjustment to correct the joint alignment. I use the form of Tai Chi power called Chai Jing in my clinical practice, and it is very effective. This professional way is effective, but it takes a long time to acquire. There is also an easier and less demanding way developed by Chinese Professor Cheng Fa Long, and her principle of this application is to first apply muscle relaxation and joint mobilization technique, and then take the involved bone to the ranges of motion, and the restoration will occur automatically. I have applied this in the elbow joint restoration too, and then I have the technique described in detail in the article that you can get online, and the way to get the articles is in the illustration below. This article is loaded with a lot of valuable information. First, the pathological causes of tennis elbow are explained in detail. First is the bony structural cause, that the radial head of the forearm inserting into the annular ring ligament. This is the most important cause, the most important pathological cause of tennis elbow. And secondly, the three extensor muscle of the elbow are attached to a tiny patch of bone on the upper arm called the humerus. This is why repetitive straining injury occur, because it's yanking on the bone. And to deal with these two pathological causes, I have explained and described in detail the method invented by Professor Long. She advised people to first loosen the muscle of the injured joint, then take the involved bone to the ranges of motion, then the bone will go to the proper places by themselves. And then to deal with the inflammation, I have given instruction regarding herbal treatment, external herbal treatment, acupuncture treatment, suction cup treatment, and nutritional guideline when you do your rehabilitation. And also I have provided a differential diagnosis of tennis elbow. Differential diagnosis means different kind of problems similar to tennis elbow, but they are not tennis elbow. If they are those problems, then you should not use this set of method to treat them. You should get somebody else, some healthcare professional, to look at them. And the flex bar that you have to purchase for $17 if you want to buy one for the rehab exercise. I have a suggestion in the article that you can make it yourself. You save yourself at least $17, and you save on taxes, when you can make it yourself. And if you use my push-up exercise, you don't even have to buy anything. You don't have to do anything. If you do not have bony misalignment, just do the exercise, and use some of the suggestion to kill the inflammation, then you're cured. And the exercises will make the muscles strong again, and then the problem will not recur. Hi, I'm Dr. George Ho. This concludes the movie. And if you like this movie, please click like and please share it with your friend in other media like the Facebook. And it would really motivate me to make more movies like this if you would subscribe to my channel. Thank you very much for watching. I'm Dr. George Ho of Vancouver. Thanks again. Goodbye. Subscription is totally free.